Hi, I'm Dr. Vimal, consultant pediatrician neonatologist at Cloud9 Hospital, Vartur, Bangalore. Heart murmurs are sounds which arise from the baby's heart due to turbulent blood flow. It can be a very benign thing to potential underlying heart condition. The common causes are baby having a low hemoglobin, having a very high fever, or overactive thyroid gland. The cardiac conditions which can cause a murmur are valvular heart diseases, a congenital heart disease, or infection within the lining of the heart, something called endocarditis. Now, how do you differentiate between the two? When do you seek help is what I would like to discuss. So, you seek help if the child with the murmur has the following things. Maybe has excessive fatigue, is sweating excessively, is feeling dizzy, is fainting, has bluish discoloration of the lips. Any of these are there would definitely warrant further investigations. The treatment for heart murmurs depends on the underlying heart condition. For example, if the baby is having a low hemoglobin, you treat that with medications. Vis-a-vis, if it's a heart issue, it will require an appropriate surgical intervention.